Hi, I'm Josh Kettleson.
And I'm Christo Schultz. So Josh, a lot of my clients are waiting until 65 to retire. Why would that be?
It's kind of funny how we're kind of programmed to that number, aren't we?
Mm-hmm.
But there's a lot of things that happen at 65 that make it attractive to retire. The first one is you just got off 15 years of your best earning years, for example. So you've hopefully been able to save quite a bit of money during that time frame.
Mm-hmm.
So that's the best 15-year period for people to accumulate a lot towards retirement. The second reason is Social Security, while it's not the case now, roughly comes into full retirement age around 65, depending on when you were born.
Mm-hmm.
And that's when you're eligible to start drawing from the contributions that you've made over your working career. But the biggest part is Medicare eligibility.
Mm-hmm.
That's the point in which an American citizen is eligible for the Medicare benefits, which means no more healthcare premiums per se. There might be supplemental insurance, but that's going to be peanuts compared to what a full-blown retirement plan is. A lot of people, even if they're financially able to, will wait till 65 to quote-unquote retire just because the healthcare costs are so much.
Right.
We're not insurance salespeople, so we don't provide policies to anybody. But roundabout, how much have you seen people pay for private insurance policies if they retire early?
It's outrageous. I mean, one of the rules of thumbs that I look at is if you retire 10 years early, so roughly 55, $250,000 is really what you're going to want to have allocated to go towards healthcare, which is crazy. You have to save a lot just to cover those 10 years. And so for a lot of people, they say, well, not worth $250K.
Sure.
I'm going to hold off till 65 or work part-time. Find a job that you can get or have a spouse that you can get some supplemental insurance working part-time, and that's another good route to get around that $250,000 deficit I was talking about if you do want to retire early.
Sure, and the importance of healthcare insurance cannot be understated, especially for an affluent person.
Yep.
An affluent person has the resources to pay, and when they have the resources to pay, medical providers and hospitals are going to expect payment. What are the risks of not having healthcare insurance between the ages of 55 and 65?
It's horrible. You can wipe out your entire net worth like that. I mean, I think that if you have to get air evac via helicopter, I think the typical cost is over $100,000. So you have one accident, boom.
And that's before a surgery.
That's before a surgery. That's before the
hospital
surgery.
stays.
Yeah, exactly. And so it's having health insurance a must, but also planning around that and knowing that if you do decide to retire early, have a plan for healthcare.
Sure. Planning for healthcare is even more important at 55 because that's when things start breaking down in our body sometimes.
That's exactly right.
So it's even more important. But to see the astronomical cost not only of healthcare, but the astronomical cost of healthcare insurance is quite shocking to a lot of clients who want to retire quote early.
Yep.
You have to find a way to replace that. You either have cash in hand, you have a fixed income stream through some type of business process that you have, or you have a part-time employment that offers healthcare insurance.
Yep.